watching Good Morning San Diego.
Guess what? The high heel doctor is in the house with tips that will help women look stylish and have comfy feet as well. Boots or spikes or stilettos or boy, you name it. If you love your high heels but they hurt your feet, well, our next guests are here to show us some tips and give us a few tips to avoid the pain while still looking fantastic. Dr. Eric Horton is you're a foot and ankle specialist, an orthopedic surgeon at Alvarado Hospital, and you have brought a high heel lover. Good morning to you.
Good morning.
This is Tina Celifie with some fantastic shoes. They hide a multitude of sins, don't they?
Yes,
high
they
heels?
do. Yes, they do. Absolutely. Love heels.
Thanks for being here this morning. Doctor, in your practice, I imagine you see a lot of problems related to high heels, and we hear about it all the time. What can happen?
Well, over time, some people are at risk of forming deformities of their toes, believe it or not, and they're not always painful, but when they are, that's when they come and see us.
If you would hold up this replica of a foot, how many bones are in the foot?
Boy, you're going to make me count them all? At least 47 or so.
Really?
Yeah.
And so what kind of problems can develop from having an arch?
Well, the problem with high heel footwear is not so much the issue with the arch as it is with the toes.
Okay.
Typically, what happens over time is when the foot is forced in this position in a high-heeled shoe,
right,
you can see how there's a tremendous amount of force on the inner aspect of the first toe, the big toe, and it eventually will angle over and do something like this, and over time it'll stay like that. And as a result of that, some people get really painful bunions on the inside, and then they can get hammer toes and corns and even nerve problems in between the toes as
some
a result
bad
of
deformities
squishing into a shoe.
So Tina, I see you brought out your beautiful high heels. You call yourself the Imelda Marcos of your neighborhood.
I do have an extensive collection of shoes. I love high heels.
What, have you had foot problems in the past?
I have not had foot problems. However, there are certain things that I think that you should do, and I know that Dr. Horton speaks to this by making sure that your shoes fit and that you're not squeezing your foot into
a too small shoe.
A too small shoe.
What is your advice? Because I think a lot of women, for many years, I was buying a size 7 shoe, and finally I figured out, you know what? My foot would feel a lot better in a size 8 shoe. And it did. It made it better, and I got rid of a lot of problems. Is that a common thing that women do?
Absolutely. There's so many women that try to shove their foot into that smaller size, and
the
sometimes
syndrome.
It's just due to availability. they can't get the size that they really need, so they force it into something that doesn't really fit right and pay the consequences. So yeah, we really recommend that they measure their foot frequently, because your shoe size does change with life, and it tends to swell during the day, and so you want to give yourself a little extra space, and you can even trace out your foot and try not to get a shoe that's any narrower than that.
What are other tips for one buying high heels? Are open-toe heels better than closed-toe? What are some other?
Sometimes open-toed shoe designs are better in the sense that they allow a little more room in the shoe. If you find a shoe that's very breathable, that it has a good flexibility, a very flexible sole, then that can be very, very helpful. Getting a width that's adequate enough, and not, if you think about it, the foot's more of a rectangle, and you really don't want to put that into something that's triangular shaped if you can avoid it.
So the high heel trend is not going away. So women just have to make smart choices when it comes to.
Yeah, and trying to limit the time that you spend in your shoes if possible. Maybe no more than 4 hours at a time. And if you start feeling pain, that could be an early warning sign.
Doctor, thanks so much. And before I say goodbye to you, Tina, what's your favorite shoe of the season?
It's very hard, but I love Christian Louboutin.
Oh, the red heel bottoms, huh?
That's right.
Yeah, that'll set you back quite a bit.
Quite a bit.
But they sure are pretty. Thanks for coming in this morning.
Thank you.
Appreciate your time.